Hello, I'm going to go give you a brief overview of this week. This week, I want you to look at sexually transmitted disease on the rise. See the full report, trends across here from CDC. Click on this link and take a look at it. Basically, we're seeing that we have a rise of STIs. You can dive into all the statistics and what we're seeing across the United States. Now, I can tell you that when you dive into this, the population that you will see most at risk are early adults and also specific ethnicities and populations. And it differs from each different type of STI. But the reality is that reproductive health, having access to birth control, having access to health care, is really critical. In Colorado, I just recently saw a study that Colorado had, and let's see if I can pull to it. Colorado actually had a decrease in abortion rates because of their increasing condom access and to birth control access. So we're seeing that in you could Google it. You could see Colorado, their efforts on increasing access has made a big change. So one of the big things is that you will see, though, that not everyone has equal access to reproductive health care. And so in your module, I have this STD health equity. I want you guys to take a look at this. Are there certain people that research shows that there are higher rates of STDs among some racial and ethnic minority groups compared to whites? And it's also important to understand that these higher rates are not caused by ethnicity or heritage, but by social conditions that are more likely to affect minority groups. And when I say minority groups, I'm talking about ethnicity, racial, but also groups that sexual orientation, sexual identity, foster youth groups. We're talking about anyone who is in a subgroup who might not have equal access to healthcare. We can also put into those groups rural communities, rural areas. So know that it's not just about one group. It's also that some groups do not have equal access. So people who cannot afford a basic needs may have trouble accessing quality sexual health services. And so I want you to take a look at these and drill down into the statistics and look to see the disparities. Now, one of the things I'm going to tell you, though, is that this mirrors what's going on in our community, too. You will see it locally with statistics in Kern County. So I wanted to show you that in Kern County, we can see that we have the highest chlamydia rates in the state. We have some of the highest gonorrhea rates and the highest syphilis rates. If you drill down into chlamydia and gonorrhea, you will see that in the statistics when you look at CDC that certain age groups have higher rates, but also certain age groups within certain specific communities, lower income communities, or where they have lower access. So know that this is something that's close to home with us. Also, with early syphilis, you will see that minority groups are more impacted than other groups, and you can drill in to the statistics, and I'll put that link in there so you could see what that is. But this doesn't just go with condom access, this goes with just in general with teenage pregnancy. There are some groups that are more impacted than others. So even at BC, when we look at condom access, we see that that our population at BC is not using condoms. And you start to ask yourself, why? Why aren't people using condoms? And one of the things that the health belief model says, this is a model on why people do things, is that there's perceived seriousness of a disease, like how serious they think it's going to be if they get it. Will they die or not die? And perceived susceptibility, like the idea that in Kern County right now, 1 out of every 4 sexually active high school girls could be carrying chlamydia. So that's a high susceptibility. So one of the things that I'm going to ask you, though, is that when you go out to Kern County and you look to see how easy the condom access is, I dare you to go out. I challenge you to go out and take a look at the community. Are there some places where there's easier access to condoms than others? This photograph was taken in East Bakersfield at one of the stores where they have all the condoms locked up. So my question to you is that why isn't there more equal access? That could some of these health disparities that we see in Kern County be because there's not equal access? So that is your discussion question. And I'm going to ask you not just to limit it to condoms. It could be a transgender youth. It could be a person in a rural community. So really challenge yourself to say, is there equal access? And I want you to take a look at that in the module. If you scroll down to the discussion question, it's really going to be about what are the accesses to services. And so what I'm going to ask you to do is based on your research, okay? And please take a look at the CDC. And then I'm also going to be posting some things in the module too. So note to look in the module. Look and research this. Which populations do you believe are more at risk than others not being able to access, and I'm going to say reproductive services? So this could be anything from healthcare to condom access to any type of birth control. I mean, also if you look at birth control, you'll see that like the male condom is much cheaper than the female condom. Okay, so look at all of those things. And then I want you to tell me to center in on one health inequity. And then one health, I'd like you to do one health disparity. So I'll give you an example right here. So if you look out and that just looking at the STDs, you'll see that if you drill down on there, that you'll see that some groups have higher rates than others. And I'm going to put a link. I remember with syphilis, there's higher rates within specific communities, and I want you to actually name one health disparity. So this is a reproductive health condition. Okay, like a disease or rate. So put the rate there, and then one health inequity. You need to show me evidence of where you see unequal access. Does that make sense? If you don't understand, definitely Canvas message me. And then I want you to give me a strategy to improve this access to services. Please be sure to cite sources and be sure to respond to at least one person to discuss number 2. Discuss what you guys have posted. I'm going to go ahead and put the rates in for Kern County too around STIs, and I would love for you to show me some other things. So health disparity, okay, make sure it's a health condition. Get that? Make sure it's a health condition. So you have to show me that it's a health condition, okay, bold. And then a health inequity, where something is not equal, okay? And it's going to be worth 10 points, and it will be due on November the 10th. So I'm really looking forward to seeing what you guys come up with. Feel free to post pictures. Feel free to post evidence, okay, that you see this health inequity. All right, that's it.